Hello, my name is Dr. Pamela Frank. I'm a licensed naturopathic doctor in Toronto, Ontario, Canada, and I'm here tonight to talk to you about the leaky gut solution. The gut, or gastrointestinal system, is truly a gateway to overall health. Your gut microbiome is an ecosystem of organisms including bacteria, yeast, fungi, viruses, and protozoa throughout your digestive tract. Far beyond just digestive health, the following organ systems are also closely related to your gut health: your immune system, endocrine system, nervous system, circulatory system, integumentary system, respiratory system, and reproductive system. A few key points to consider. There are 10 times the amount of bacteria in our body than our own cells, and the majority of them are found within our digestive system. The gastrointestinal system contains 90% of your body's happy hormone serotonin. And most importantly, approximately 70% of your immune system is housed in your gut. As you can tell, gut health doesn't stop at digestion. The health of our gut affects nearly every system in our bodies. Leaky gut is a term that refers to intestinal hyperpermeability and has become an increasingly more common health problem. Leaky gut causes major health problems including autoimmunity. But how? Intestinal hyperpermeability is exactly what it sounds like. The digestive tract is no longer able to ensure the good stays in and the bad stays out. Instead, the tight junctions, or the proteins holding the intestinal walls together, are loosened. This leaves sizable gaps for undigested food particles, digestive fluids, and toxins to enter your bloodstream. Your body reacts to these foreign particles in your blood by producing immune antibodies or pro-inflammatory cells to ward them off. This breeds chronic inflammation, food allergies, and various health complications. Of course, there are no signs of improvement until the gut's permeability is addressed. Fortunately, we now have a better understanding of the causes, obstacles, and treatment methods for leaky gut, so there is a stop to the cycle. Several factors have proved to negatively affect your gut's integrity. The most prominent include the standard American diet, exposure to chemicals, chronic infections, gluten and other grains, food allergies, excessive medications, and poorly managed stress. The standard American diet, rightfully known as the SAD diet, is one of the leading causes of the chronic health issues we see today. According to a 2009 study conducted by the USDA, 63% of the calories that Americans are consuming come from processed foods containing preservatives, refined grains, and added sugars and oils. It's almost as though the general public took it upon themselves to refigure the food pyramid to consist of grain at the base, dairy in the middle, and sugar at the top, when in all honesty, none of these foods have any business being part of our diets at all. You can call it what you want: food, frankenfoods, food-like substances, fake food, but you most definitely can't call most of our food supply real food. When the majority of our diets are packaged meals with paragraph-long ingredients lists and labels we can't understand, we are not eating real food. A couple of alarming facts. The United States Food and Drug Administration, or FDA, has approved approximately 3,000 different food additives, preservatives, and colorings without adequate research on their safety. The average person ingests over 150 pounds of additives each year. The magnitude that these chemicals are allowed into our lives is incomprehensible. We are becoming more and more aware of the consequences of this fake food lifestyle, and it's simply unacceptable. There's only one factor in the leaky gut epidemic, but definitely a big one. Up next, we'll be discussing other factors that are responsible for the onset and progression of leaky gut. Inflammation is a vital immune response and is your body's attempt to defend itself against pathogens, heal from injury, and repair damaged tissue. Chronic inflammation, however, is not beneficial to our bodies in any way. In fact, it can worsen your body's ability to recognize foreign invaders and puts your body in a state of stress for extended periods of time. This can cause lasting damage, increased food allergies, and eventually autoimmunity. This type of inflammation can be caused by a number of things, but largely seen as a result of leaky gut syndrome and poor dietary habits. If chronic inflammation goes untreated, leaky gut is worsened and the body ultimately loses its ability to repair from the damage. Gluten is the general term for a mix of proteins in many grains, such as wheat, barley, spelt, kamut, and rye. Gluten has found itself in much of our food supply, disguised in packaged foods and featured in most pre-prepared dishes. It is no surprise that our consumption of gluten has increased immensely and our health is suffering from it. Gluten allergies, sensitivities, and intolerances are becoming increasingly more common. Gluten-free has become a buzzword within the health community, and people are finally beginning to explore how dangerous gluten can be for their health. How dangerous is it, you ask? Gluten makes your gut leaky. Simple as that. Zonulin, a protein found in your intestine, is interfered with by gluten, further opening the spaces between the cells. The antibodies that are normally released as a result of leaky gut are accompanied by more antibodies created to attack one of gluten's more prominent building blocks, gliadin. This leads to more inflammation, more bodily confusion, and more health complications. In other words, your body reacts to the consumption of gluten by creating a defense mechanism to fight it. Once the damage has occurred within the digestive tract, it is then distributed throughout your entire body. Aside from contributing, if not entirely causing leaky gut, gluten increases inflammation, overall digestive distress, and alters the balance of our microbiome. Our microbiome must be equipped with efficient, healthy bacteria in order to be successful in carrying out its necessary functions. Without the proper balance of bacteria, the following functions are disrupted: digestion, immune response, nutrient absorption, hormone regulation, vitamin production, detoxification, mood management, and many more. Gluten produces both primary and secondary effects. The damage gluten causes that we have talked about thus far has mostly been the primary effects: intestinal permeability of the blood-brain barrier, the onset of autoimmune diseases such as celiac disease, Crohn's, and ulcerative colitis, the development of psychological disorders, dysbiosis or abnormal bacteria growth, acute allergic or IgE responses, and a delayed antibody response. While all of these issues are very serious within themselves, they too cause further complications. Next comes the secondary effects of gluten. The secondary effects of gluten exposure include severe nutrient deficiencies such as iron and vitamin B12, systemic inflammation leading to organ and tissue breakdown. It may seem a bit redundant that we keep coming back to how your body acts on gluten, but is one of the most important pieces of information you can take from this webinar. Gluten is a major component of the leaky gut cycle. It is present in the onset, the maintenance, and the progression of this damaging condition, and it should not be taken lightly. As you can probably guess, gluten's path to disease is pretty direct. The first step is when gluten's contribution goes unnoticed. At this point, it is likely there are little to no symptoms. This is where most people will assume that gluten won't hurt them and therefore can eat it no problem. Unfortunately, the lack of apparent symptoms does not mean that gluten doesn't hurt your gut. In fact, it takes exposure over time and the accumulation of damage before leaky gut will be noticeable. For those cutting out gluten before they feel any physical discomfort, they are still treating an underlying issue even if they can't quite feel it yet. The next step is the progression of subclinical problems. This is where leaky gut truly begins to develop. Often the first thing that will be noticed is increased food and environmental allergies. Digestive distress may begin to become more frequent. Unfortunately, it is common for people to still avoid blaming gluten for their discomfort. The last step is recognizing the problem. However, it is not usually recognizing gluten as the problem, but the acknowledgement of the problem that gluten has caused. For example, if someone is diagnosed with a chronic disease or develops inflammatory changes, most medical doctors will begin treating these conditions rather than examining the origin. It's a shame that this happens so often, as if gluten was recognized as the main problem during the early stages, then a lot of these health issues could be avoided entirely. Gluten, however, is not the only concern when it comes to avoiding leaky gut. We will be going over other issues that contribute to this dangerous syndrome in a moment. Much like the additives and preservatives flooding our food supply, pesticides are also a big part of what's on our plates. There are 3 million tons of pesticides used worldwide each year, and more than 16,000 chemicals involved in the production of these pesticides. Studies to ensure their safety on humans have been very limited, whereas some have no documented research at all. While we are not entirely sure of their safety on human health, we do recognize strong links between pesticide exposure and nervous system disorders, immune system suppression, reproductive damage, hormonal imbalance, thyroid issues, type 2 diabetes, obesity, asthma, migraine headaches, attention disorders, and developmental delay in children. The magnitude that pesticides, along with the steroids, hormones, antibiotics, and excitotoxins, show up in our food supply is truly frightening, and to think it isn't a main component of our leaky gut trend is simply impossible. Medication is severely overprescribed in the current medical model used today. Medical programs train doctors to medicate symptoms even when they are unsure of the cause. This, in the short term, has seemed to work because the patients experience temporary relief from their discomfort. But what isn't taken into account is how these excessive prescriptions have affected our bodies. For example, statin drugs used to lower cholesterol have been shown to lower vitamin D and coenzyme Q10 levels. While it may be lowering cholesterol, it is simultaneously causing nutrient deficiencies, muscle fatigue, increased blood pressure, and weakened immunity. Painkillers like ibuprofen, naproxen, and aspirin contribute to vitamin C and iron deficiencies, leaving one vulnerable to disease and eroding the mucosal lining of the stomach. Acid reduction medications hinder the digestion of protein, absorption of calcium, and vitamin B12, often causing chronic pain problems. Long-term use of antidepressants, too, significantly impact your gut's motility and causes digestive issues. Lastly, it's important to note that almost all medications are unable to differentiate between the good bacteria in our gut and the illness it is trying to attack. That results in an altered microbiome and a much greater risk of infections. As you can tell, drugs offer a lot of unintended consequences that can affect our health very badly. There are very few situations where drugs should be your first solution, such as a life-threatening infection or surgical situation. Without the immediate or emergency needs of medication, it is best to treat the issue than it is to temporarily patch up the problem. Our gut has 5 critical elements or defenses that it truly needs for healthy gut function. In order from the outermost layer of defense, they include mucosal IgA, otherwise known as immunoglobulin A. This antibody found in the mucous membranes is considered your gut's first line of defense against toxins. Tight junctions. These are small proteins that are responsible for holding your gut cells together. This is what most directly is affected by leaky gut syndrome. Gastro-associated lymphoid tissue, or GALT tissue. This is your gut's concentrated immune system, and in fact, 70% of our immune system altogether. This, the gut's last and most powerful layer of defense. The gut's accessory defenses include friendly bacteria. As we mentioned, we have more bacteria in our bodies than we do our own cells. This bacteria can communicate with the GALT, warning it of potential danger. Stomach acid. This is absolutely essential for the digestion, absorption of nutrients, and defense against infections. If there is any dysfunction throughout your gut's line of defense, these 5 primary barriers need to be evaluated in order to heal and be treated properly. The first step of healing is ruling out the fundamental causes of leaky gut. It's important to recognize that it's very rarely only one cause, but a combination of several causing the damage. You must first rule out or begin to recognize the following: vitamin deficiencies by functional nutrition testing, infectious pathogens by blood and GI tract tests, heavy metal toxicity by urine or hair testing, gluten sensitivity through HLA-DQ genetic testing, environmental allergies via skin or blood tests. If any of these come back positive, you have your first step of instructions. Address the deficiencies, implement dietary changes, limit exposure to allergens, and continue detoxification methods. Once you have a better understanding of your body's unique needs, you can begin the formal functional medicine protocol, which is the 4 R's. The 4R program is administered to help you heal from digestive distress, reverse gut complications, and rebalance your gastrointestinal microbiome. It is an incredible tool to acknowledge and treat health issues, dysfunctions, imbalances, and personal health needs. It is done in the following order. Number 1, remove. Eliminate problem foods, toxins, low-grade infections, and oxidative stress. Number 2, repair. Begin reintroducing a clean diet with essential nutrients your body needs to repair. Restore. Repopulate your gut with healthy bacteria to restore the proper balance of gut flora. And replace. Replace digestive enzymes, antioxidants, and immune-boosting vitamins to promote sustainable and healthy digestion. As a functional medicine practitioner and naturopathic doctor, I am trained in this protocol and enthusiastic about making sure your individualized needs are addressed during the process. At this point, you may have already removed things you already knew were to be detrimental to your health, such as gluten and known allergies, but you'll also want to remove much of the chemical burden in your daily life. This includes pesticides on food, genetically modified organisms, unnecessary medications, and unnatural household cleaners. Once you have an understanding of what should be removed from your daily life, and you have begun to implement those changes, it is time to begin repairing the damage that has previously been done. This is done by calming chronic inflammation and reintroducing nutritious foods, digestive enzymes, probiotics, essential fiber, vitamins, minerals, and acids. For some people, these steps may mean implementing intermittent fasting, supplementation, or personalized diet plans that cater to their specific health needs. Again, be sure to consult with a naturopathic doctor like me to be sure you're beginning the most appropriate repair route for your needs. Nutrients must be replaced for effective healing. While everyone's needs are highly individualized, here are some common supplements that have been proven to be helpful in the gut healing process. Probiotics, prebiotics, digestive enzymes, fiber, collagen, turmeric, L-glutamine, and quercetin. These are only suggestions. I'm unable to prescribe these supplements to you without comprehensive testing, as everyone's nutritional needs are different. However, the main takeaway from this is that you should not rely solely on supplements. They can be used to help your healing process, but the goal is to be able to sustain wellness with whole foods and healthy lifestyle choices long term without the need for piles of pills. The most difficult part of health is maintaining it. Even if you build a strong foundation during the healing process, without the proper diet, lifestyle choices, and stress management long term, you can fall right back into the same gut-destroying patterns. Remember, health is a journey, not a destination. Although there's plenty of research on the dangers of leaky gut, it is still considered a bit of a mystery. Many cases go misdiagnosed and in turn not properly treated. It is crucial to work with a naturopathic doctor like me who is familiar with the condition and will perform the appropriate tests in order for you to heal effectively and efficiently. Always start with the fundamentals, honor your body's unique needs, and skip the guesswork. Thank you for taking the time to listen to this webinar. I love sharing this topic with people who are eager to transform their health. If you have any further questions, please post them in the comments, and I'll be more than happy to address any concerns. Please remember, I am always here to support you. Thank you again for being here. My name again is Dr. Pamela Frank. I'm a licensed naturopathic doctor in Toronto, Ontario, Canada. My phone number is 416-481-0222. My email address is pfrank, N like Nancy, D like David, at forcesofnature.ca. That's pfrank, Nancy David, at forcesofnature.ca. And my website is naturopathtoronto.ca. Thanks.